Right, let's kick us off because we've got a jam-packed community of practice today. So welcome, my name's Sarah Chesel. I'm Head of Research and Innovation at NHS Dorset, and I have the privilege of being the lead for the Dorset Innovation Hub, which is hosted by NHS Dorset. So if we can have the next slide, please. Thanks, Sandra. So just a couple of points for this community of practice, which we run for you. It's this community of practice is recorded, so please let us know in the chat. I beg your pardon. So this community of practice is recorded and we actually have it on our YouTube channel. So you'll get the link out to that later on. So if you haven't been able to go to part one, you can go to part one of this community of practice. So demonstrating impact. The slides will be available for you after the event and we make those available on Future NHS. And the point I was going to come to about the fact that we're recording this event. So we're going to take screenshots from the event and we use that for our communications and our reports just to promote the work we're doing together. Please add in the chat if you would prefer not to be in the photos. That would be appreciated. And do give a shout out on social media or within your organisation. So thinking about LinkedIn, for example, is what we use. So hashtag Dorset Innovation Hub and spread the word about the work we are doing together. Cram-packed agenda, but we aim to finish at 1:50 promptly. So I will hold us all to that so that we can get off and maybe we can stretch our legs before folk go to their 2 o'clock meetings. Next slide, please. So as I said, my name's Sarah Chesel. I'm passing over to Sandra, who's leading the training today. Sandra?
Hello everyone, my name's Sandra Courtier and I work at NHS Dorset as the Innovation and Research Programme Manager.
Thanks, Sandra. I'm coming to Michelle.
Hi, I'm Michelle. I'm a Senior Lecturer in Workforce Development at Health Sciences University, part of the core team for the Dorset Innovation Hub.
Thanks, Michelle. I'm going to the next slide, please. First of all, and as those of you that have worked with us before will know, we get you to do some hands-on work. So here we're asking in the chat, just as a single chat message, can you put your name in, what your role is, the organisation, and what you want to get out of this community of practice. And as Sandra's delivering the training, Michelle and I are just going to look through the chat to make sure we get everything covered for you or pick up on questions that you may have from the community of practice. So we'll just give a couple of minutes for that. So we're not just asking you for the sake of it. We are actually asking so we can try and make sure we pick up on points that you would like covered. Thank you to all the core team members that have been adding the organisation that they work in. And please do feel free to contact your Dorset Innovation Hub core team member. It's about building those connections. Thank you. We've just got some coming through. That's fantastic. Lovely to see people from across the partner organisations, Dorset Healthcare, NHS Dorset. We've got some professional leads, Dorset Healthcare, Dorset County. Okay, just as we wait for others to pop their points into the chat, if we could go to the next slide, please. Thank you. So the Dorset Innovation Hub, just really briefly, I just want to outline the work that we do together, just really, really briefly. So we are a strategic partnership that work together. And as you can see on this image, we work with higher education. So we work with the 3 academic institutions within Dorset. And we're also looking at signing up higher education as well. We work with the voluntary and community sector assembly. We work with our 2 local authorities for business now, recognising Dorset Local Enterprise Partnership finished at the 31st of March this year. Our local authorities and Dorset Police and our healthcare providers as well. So our 2 acute providers, the community provider and NHS Dorset itself. So we work together, joining the dots, making the connections with the existing relationships to promote and facilitate adoption of proven innovation within Dorset that actually benefits the needs of our population. So working on priority innovation projects together. And next slide, please. And just quickly again, just so you can get a feel for who folk are, we've got a couple of images here. Our programme group is likened to an integrated care partnership of ICP, because obviously it's wider than just health. Representatives from the partner organisations that oversee the programme and the priorities and receive risks. Don't worry, Helen, it's lovely to have you joining us in this community of practice. And on the right hand side, we've got the image of the core team, small but perfectly formed. These are programme managers and project managers who work with us, and we work together within the organisations, providing support, facilitative support and specialist advice with regards to innovation. So a great team creating connections and working on prioritised innovations within Dorset. Next slide, thank you. So today we invited you to join us to find out more about the measures and data sources, the different types of measures and data sources, and thinking about the potential pitfalls and how you can guard against them. I presume we make the presumption, that actually you're undertaking a project. So just each time think about the project that you're doing so that you can think how you can avoid these pitfalls and guard against them. And Sandra's going to be going through the use and power of statistical process charts, SPC charts, and she'll come to that in just a minute. Next slide. Thanks, Sandra, and handing over to you. Thank you.
Thank you very much, Sarah, and really lovely to see you all today on this community of practice call. And I look forward to taking you through the set of slides we've developed for the session today. Just to say that we've built some time in at the end of the session for questions, so if you wouldn't mind holding fire on questions until the end, then that would be fantastic. Just trying to get through all the content within the time that we've got allocated. So as Sarah mentioned, today is part 2 of a 2-part series on demonstrating impact. Part 1 was back in January, that was led by Michelle. And within that, we covered aspects such as what do we mean by the term benefits, the different types of benefits, the importance of engaging stakeholders, and the use of theories of change frameworks. If you didn't catch that session and it's something you'd like to catch up on, a recording of it is on our Dorset Innovation Hub YouTube channel. And in today's event, I'll be using the word measures quite a lot. And I suppose when I talk about measures, it's a term that is used interchangeably with other terms like metrics or indicators. And it essentially refers to a unit of interest that might allow us to make a judgment on the impact from a change. And there's lots of different measures out there, but generally they are categorized into one of 4 different types. So firstly, we've got our structure measures, and they generally refer to those physical things, so the resources that we have available to us. So things like number of beds, particular IT systems, number of staff, number of devices. And they are quite good measures to use because they are efficient in terms of capturing that data. They also relate to aspects that have the potential to affect multiple different processes and outcomes. But they also can be described as being quite blunt in terms of a measure. And they are also quite commonly those aspects of a process that are quite hard to change. And it's not always clear that change within those structure measures will actually produce improvement. Our second type of measure are process measures. And these refer to those actions that might be involved in delivering a service. So again, for example, a process measure might be the number of people screened or the number of people vaccinated. the amount of time it's taken to receive an assessment. Process measures are great because they do have that capacity to make adjustments. So we can take account of any exceptions or contraindications that might relate to that process. But on the flip side, with process measures, they might not always capture the reality of process delivery. So in other words, just because something was done does not necessarily mean it was done well. Our third type of measure is outcome measures, and these relate to the effect of the process or the service on that endpoint of interest. So, for example, mortality or levels of independence, recurrence rates, or financial savings. And these are great because they do ultimately demonstrate impact on that endpoint of interest for us, but they do have complexities with them in as much as they will be influenced by multiple factors. So things like morbidity and age, and adjusting for those type of multiple influencing factors can be quite challenging. Sometimes with outcome measures as well, we can need quite a long period of observation before the data is actually available. And then finally, our last category, our last type is our balancing measures. So with balancing measures, we're looking at monitoring any unintended consequences from your change or your improvement effort. So for example, if you are initiating a new process that's looking at increasing mobility in older people, a balancing measure that you might be interested in collecting would be the rate of accidents or the rate of falls. And sometimes the best way to try and unlock what those balancing measures could be is by listening to your skeptics. So if you listen to what concerns that they raise about your change or your improvement project, then that quite often can flag what those balancing measures could potentially be. So there's lots of different types of measures out there, but how do we know which ones we should be using? And really interested to hear your thoughts on how you might go about identifying which measures you should be using for an evaluation of an improvement or a change project. So if you wouldn't mind putting your thoughts on that in the chat, that would be fantastic. Thank you, Helen. So yes, a customer feedback. That might flag some balancing measures. Looking at previous research that's been done. Always a great idea to look at what's been done before and sort of learn from others. So identifying the difference we want to make first. Okay, I like the one about timescales. That's a very good one, because we always need to be very mindful about what our capacity is with these pieces of work. Where issues exist. Yep, so some great suggestions there. So thank you ever so much for those. It's really interesting to see and to read. So one of the things I wanted to flag as part of the session was the use of theory of change frameworks. So I'm not going to go into those in detail today because that was something that Michelle covered in her session back in January. But in terms of how do we know which measures to use, if we use a theory of change framework, so something like a logic model that forces us to put on a piece of paper our plausible theory as to why X will lead to Y, then it allows us to articulate what all those different steps are. And from that, we should be able to unpick what it is we need to be measuring in order to be demonstrating impact. As well as using things like theory of change frameworks to support with that, we should also be talking to our stakeholders. So we might go into a piece of work with a particular viewpoint, but that might be different to our stakeholders. And it's really important that we capture those other perspectives when we're developing our measurements. We also need to be mindful that there might be mandatory measures that we need to collect if we've got funders or regulators that are part of the piece of work that we're doing. And I would also say that when you are putting together your measures, think about who your audience will be for this piece of work, because the measures that you use will differ very much depending on who the final piece of work will go to. So whether it's information that goes to commissioners and into business cases, or if it's information that will go to a service user group, they will perhaps have quite different needs, and they'll have quite different requirements in terms of what measures they might be looking to see within your piece of work. But ultimately, through that process, what we should be trying to do is collecting together what we call a family of measures. And what we would like those family of measures to do is to answer 3 key questions. The first question being, was the change implemented successfully? Secondly, did it succeed in achieving whatever its intended aim was? So that aim that you would have stated right at the beginning of your project, did it actually achieve that aim? And lastly, did the change create any new problems? So we've got an idea of what measures that we want to be using within our project to demonstrate impact, but how do we know if those measures that we want to use are any good? And there's lots of different qualities that you might look for in a good measure. I've chosen to highlight a few which are on the slide at the moment. Some of them are quite obvious. So for example, relevant and available. Very obvious, but is the measure actually relevant to the area that you're evaluating? Available, so does the data actually exist? If it doesn't, and it's a really key metric, a really key measure that we should be reporting back on, it might flag an area where perhaps we need to create a new data collection process. Timeliness, so both from, I suppose, from 2 angles. So the amount of time it might take you to collect the information, but also thinking about how much time needs to elapse before that data is actually there for you to access. Validity, so are we measuring the construct that we think we're measuring, and the ability of the assessment to provide information which is both valuable and appropriate for the intended purpose. Reliable and stable, so when we're thinking about that, we're looking at the consistency of measurement, so how well measurements agree if the same measurement is performed twice. If there are issues with reliability, that it might be down to the data collectors, if you've got more than one person collecting data, or it might relate to the stability of the data item that's being examined. Capability, so does the team actually have the capabilities needed to be able to collect the data that's required? Or are the measures that you're using too complex or perhaps too specialist? And then finally, standardized, which I think is particularly of relevance if you're looking at a project that's collecting data across more than one organisation. So do the different organisations collect and report the same data item in the same way to the same definitions? So is it standardised in that way? So we've got our measures that we're going to use, and we're happy that they're good, robust measures. So what data sources should we be looking at, or what data sources are you aware of or that you've used before to collect this type of data? I'm aware there's quite a broad range of organisations represented on the call today, so it'd be really nice to hear from you some of the data systems or data sources that you've used in the past for these types of work. So yes, DICE. So for anyone that's not from the Dorset system, that's our Dorset Intelligence and Insight Service, which is a fantastic population level data reporting system. Yes, national cancer data sets. Mosaic system, I think, is that for chemotherapy and cancer services?
I believe it goes wider as well.
To go wider.
Yeah.
National audits. Yep. Model health system. So it's your case management system. Thanks, Rick. Yes, Clara, incidents, complaints, they're so that sort of data that a patient experience type service might be collecting is really rich in terms of providing a source of data. Yes, looking at internal reporting and any safety incidences, looking at risk registers, etc. Thank you. Some really interesting ones that are coming through on the chat. So thank you ever so much for sharing those. On the next slide, what I've done is just put a bit of a brain dump down in terms of the ones that I'm aware of, and some of the ones that I've used before in the past. So thinking about things like service users, staff, family and carers, human resources records, training records, information systems. National clinical audits came up in the chat. So there's all sorts of different data that's out there. And I think perhaps what's key is that we try to collect as much data is to try and use more than one data source if possible. So if we're answering a particular question, try and think about the different sources of data that we might access to answer that question, because it's only by accessing those different data sources that we'll build that bigger picture of the truth of what's happening around that outcome of interest. In terms of thinking about some potential pitfalls when we're measuring data to demonstrate impact, some of the points that I've put on the slide include reliability. So these is of perhaps particularly something to be aware of if you've got more than one person collecting data. So just because you interpret a question in a particular way doesn't mean that everyone else interprets it in the same way. So it's really important when you've got more than one person collecting data that you test everyone's understanding of how a data collection form should be used. From an ethical standpoint, we should only be collecting the data that we need and not be collecting data from a just in case it's needed point of view. Not collecting baseline data is one that I've seen in the past. We can go back and collect things retrospectively sometimes, but not always. and it can also be quite a complex and time-consuming process. If we don't have the right skills and capacity within the team, then data quality can be affected. And if there's data quality in terms of missing data, we need to be very clear in terms of whether or not we're going to go back and try and fill in those gaps, or if there's a certain level of missing data we're willing to accept, or if there is a certain level of missing data where a case becomes excluded. We need to make sure that our measures are specific, that we're not using terms within our measures that are quite broad and could mean a whole different host of things. Again, thinking about the sample also being specific, so perhaps setting your inclusion criteria and also your exclusion criteria for your samples. And making sure that we've got the correct approvals in place. So particularly if we're thinking about collecting data from service users, does your organisation have a process where that type of activity is expected to be registered and recorded? And if so, make sure that those approvals are done. Another potential pitfall is if we're in a scenario when people want to start tinkering with validated tools such as quality of life questionnaires, because then they lose their ability to be able to measure that outcome of interest. So those are the potential pitfalls. So how can we perhaps guard against some of those? For me, perhaps a key one is to start planning for measurement right at the very beginning of a project. And as part of that, make sure that you do talk to your stakeholders. Talking to your stakeholders is a key theme through all of the training that we do. They're such a key and integral part of any step within a project. And within that, make sure that we do allow enough time for approvals and don't underestimate the amount of time it can take for approvals. Also be very clear on what your deadlines and capacity is, and also perhaps be very honest about what your capacity is. Be clear on your audience and what their needs are. And perhaps as part of that whole planning piece, look at formalising that in terms of an evaluation plan, so you can monitor your progress and see where perhaps you're going slightly off track, and perhaps monitor whose responsibility is to collect various different aspects of your measurement piece. Make sure that training is given if training needs are identified, and absolutely always test and pilot any data collection forms. It's not until we try these things in a real world scenario that we really know that it covers and meets the needs that it's designed for. So the data that we'll generate through our measures very broadly will fall into one of two camps. It'll either be quantitative or qualitative. So quantitative data, it's that data that's numerical, countable, measurable. So how many, how much, how often. Your qualitative data is that descriptive, interpretive data that provides insights into the reasons, processes, or contexts that are often behind certain behaviours or events of interests. So each has its own purpose, function, strengths, and difficulties. But what you will generate will very much be guided by the types of evaluation questions that you're asking, also by the resources and the capabilities that you have. But what we would advocate wherever possible is to consider a mixed method approach. So consider an approach that allows you to generate both types of data. So for the last sort of 5-10 minutes of my section of today's event, I wanted to go through a tool that we feel is particularly helpful for the analysis of quantitative time series data. That's not to say that we are ignoring qualitative data. What we're planning to do is a dedicated community of practice event like today that is focused very much on qualitative data, and that will be, we're planning for that to be in October. So if qualitative data is something that is of interest to you and you'd like to find out more information on, then do look out for those adverts that will come out hopefully in the next couple of weeks. So the tool that I am referencing are SPC charts, which stand for Statistical Process Control Charts. And over recent years, they've been very heavily promoted, and there's been a lot of education on them from NHS Improvement and a lady called Sam Riley and her team, who have put together a national campaign called Making Data Count. So this might be something that you're already familiar with. You might have heard the term plot the dots, but it's something that we wanted to highlight and to make you aware of if it's not something that you have come across before. This is only going to be an incredibly light touch, but hopefully it will give you enough interest to then investigate a bit further after today's event. There are some references and some signposting we'll provide that will enable you to do that for SPC charts as well. So before I go into SPC charts, what's really important to do as a first step is think about what we mean by the term variation, and why it's important to understand the different causes of variation. So again, if you wouldn't mind going back to the chat, and if you wouldn't mind sharing your thoughts on what you feel is meant by the term variation. So fluctuations in data, unusual or unexpected, fluctuations, distance from another or planned outcomes, differences in outcomes or measurements. Yep. Difference from unexpected. Differences and changes in results. So yes, so thank you very much for sharing those thoughts in the chat. And yes, so taking it down to a very basic level, the variation is that change from one data point to the next. And variation is present in every aspect of everyday life. And when we examine variation, what we're able to make an assessment of is the stability and predictability within a data set when we look at how spread out or how closely clustered data is. So when we think about variation, like I say, it is seen everywhere and it has many different causes. But for the purposes of SPC charts, we divide the causes of variation into common causes and special causes. So what is normal? So common causes being things that are expected, usual and known, special causes being those events that are unexpected, unusual and new. So thinking through an example of your journey time to work, that will it's very unlikely that that will be exactly the same amount of time every day of the week. But you know that there are certain reasons that will affect that journey time. So those common causes are things like the mode of transport that you use, the time of day that you choose to leave, and the route that you might take to work. They're things that you know will cause a change to that journey time. Whereas special causes are things like an accident that's caused a delay on a road, or unexpected roadworks, or extreme weather events. So those things that you can't plan for, that were unexpected, and are not everyday occurrences. So SPC charts are a time series chart, So they are great for quantitative data that's collected over a period of time, be that days, weeks, or months. And in order for the statistics behind them to be robust, we do need at least 15 data points. But what the SPC chart allows us to do is to be able to make a distinction between those common causes of variation and those special causes of variation. So common causes of variation where there are changes, but nothing that's really enough to get overly excited about. But the special causes are those instances where there's signals in the system to say that there has been a significant change, something that's statistically significant that indicates there's a real either upward trend or downward trend in whatever it is you're examining. They also give us a way to assess whether or not a process or an outcome is reliable when in control. And it also gives us a way of assessing whether or not a process is capable of delivering to a set standard. So the next slide I'm going to show you is an example of an SPC chart, but I just wanted to preface that with just to say, don't worry about having to have particular Excel skills or math skills to be able to generate SPC charts, because the fantastic people at Making Data Count have put together a very easy to use Excel workbook that if you plug the data in, generates an SPC chart for you. So this is an example of what an SPC chart might look like. So the dotted line running through the middle is our data points line. So the way the SPC charts are formulated in the Making Data Count tool is that those points that are in grey are your your common cause variation. So they're your everyday normal expected variation in your process or your outcome. The ones that are in orange are special cause, but special cause from that concern perspective. The ones that are in blue are your special causes, but from that improvement perspective. So something that's signaling there's a true improvement change that's been seen. There's a solid line that we're running through the chart, which is the mean line. And then there are a broken grey line either side of your data points line, which is the upper and lower process control limits. And these are the boundaries within which 99% of your data points will always fall. And then if you have set a target, that will appear as a broken red line. As I've said, the process control limits are the boundaries within which 99% of your data will fall. So if your target line is way outside of those process control limits, you can see that you are not going to be able to meet your target, either because it's been set to an unrealistic level, or there's a really significant change that needs to happen to your process in order to be able to meet that target set. So as I've mentioned, the Making Data Count team have a space on the Future NHS platform. Please do have a look at that if this is something that you think might be of use to you. Within that platform, they've got a wide range of training offers depending on how you want to use SPC charts and your level of knowledge and experience. There's lots of tools and templates, as well as research articles and videos, all the sort of tools that you might need to be able to facilitate and help with using SPC charts in practice. So just to wrap up from me, just a summary of some of the key points to take away. So when we think about measures and generating those measures, we should be aiming to put together a family of measures that covers the key questions of: was our change implemented successfully? Did it achieve its intended aim? And did it create any new problems? When we're looking at our data sources, be aware of those wide variety that are out there and try and use more than one data source to answer your measure wherever possible. Engage your stakeholders. Stakeholders, as I say, are key through every stage of a project, and also be very much aware of your audience when putting together your measures and your measurement piece for your evaluation. Start your planning early. Any time you invest in your planning will be time very well invested. It will allow you to create your baseline. It will allow you to pilot any tools. It will allow you to get those accesses in place to data sources, put any approvals in place that are needed. And also be honest about any capabilities that are needed. Be honest about the capacity within the team. And then finally, SPC charts. If you're collecting time series data, please do have a look at SPC charts. They are an absolutely wonderful tool and are absolutely worth exploring further. So thank you very much for listening and for participating and sharing your thoughts in the chat. And then opening the floor now to questions.
Thank you, Sandra. Just as folks start putting their questions in the chat, or perhaps if you can put your hands up, that's brilliant. Just while we're waiting for hands to go up or questions in the chat, I worked my way through the chat and people were asking about things like articulating qualitative impact. So Sandra, you've already said about the October community of practice, and I believe that's going to be delivered by Michelle, and we wanted to make sure we've got plenty of time for qualitative data being explored and discussed. Folk were in the chat talking about steering staff to evidence their value in practice, and I think Sandra, you touched on that from the perspective of actually making sure that folk are looking at their work, but also looking at baselining, which is important. But also, how do we make sure, and there's something about making sure that reproducibility, making sure that if somebody's collecting data, it is interpreted in the same way as someone else. So there can be validity in the data that you're collecting. It was a really quick whistle-stop tour there for SPC charts, but they really are very powerful. So coming through to Jenny. Jenny, your question, if you may.
Hi, thank you. Sorry, not getting myself off mute quick
You're
enough.
okay.
Yeah, so I was interested in, because obviously, Sandra, you talked about one of the pitfalls being not having baseline data, and I'm currently in that situation at the minute, where I'm trying to measure something, but I've not got anything to measure against particularly. Have you got any tools, tips, thoughts about an approach that could potentially be useful in that situation?
I suppose in scenarios where we've had similar, because I've had this scenario myself before in the past as well, and we have tried to, so this is from very much from a health data perspective, tried to go back to medical records to extract the information, but it does very much depend on the quality of coding and whether or not the scenario that you're interested in is actually coded, which is not always. So what we've had to do in the past sometimes is use some of that early implementation data as a bit of a baseline, or to compare against if you've got similar centres that perhaps haven't implemented a change, benchmarking against equivalent services in your organisation or different organisations that perhaps are reasonable to compare yourself to. I think it will sort of, the approach will differ depending on the scenario that you're looking at. Have you sort of come up with any thoughts on how you might tackle it?
So those two things are really helpful, actually. I think part of the issue is that it's kind of it's qualitative data probably more than quantitative that I'm going to be able to kind of capture. It's around the productivity measures that we're seeing with a speech recognition solution. and we don't have any data from kind of, you know, how long it took somebody to write a letter compared to now how long it's taking them to dictate a letter. But actually that kind of that second sort of thought you talked about, with actually looking at comparing maybe people who are doing that dictation, are still typing versus the not. But again, I think then the other pitfall that you get then is kind of like, how comparable are two people?
Yes, absolutely.
As
And I think as
well.
long as you're
So,
very open and honest about
yeah,
this is our data, but this is perhaps needs to be interpreted with this and this health warning.
yeah,
And I think, yes, we've had, again, similar scenarios where we've had to go back to patients and service users and ask for their sort of thoughts on what their scenarios, their quality of life was like before the intervention. And again, you're relying on recall, but it's
yeah.
your best proxy to try and make some form of judgment from.
Yeah.
Jenny, thank you for your question. I'm going to move us on, just mindful of time, and we've got a couple of more slides to go through. What actually that was really helpful that you raised that point, and great to be able to discuss it through briefly. But it's also about thinking about when we're making changes to practice, when we're implementing an innovation or a new product, a new thing, how do we know that it's an area where there's a need? And there's something about going again back to that baseline. So where Sandra was talking about always actually identifying what is the need in the first place, and trying to be able to measure, because actually then we know why we've got to make the change. So thank you. Just moving on to the next slide. You can see it's a complex area. So there are I said in the chat that we would get this to you after the event. This will be available for you on Future NHS. All of these are live links, so really do have a look at. They're great resources. And SPC charts, as you can see very briefly with that overview, are powerful, but it's really important to be mindful of the power of data and actually understanding your data. Really, really important to understand. And I wonder, Sandra, whether we ought to explore just doing an SPC training session at some point for our community. Next slide, please. Thank you. So really quickly, just a plug for the Dorset Innovation Hub public website. We've got resources, tools, case studies, blogs, our newsletters, and then we've also got our training program and our opportunities to go into wider training opportunities that are across the whole system and nationally. And then next slide, just I'm mindful people starting to drop off. We've just got a couple more minutes. Sandra's going to pop, I believe, in the chat. Are you going to pop that in the chat, Sandra? Lovely.
I'm hoping it'll
Sandra's
come up
got
on the
poll.
screen.
It has indeed. Thank you.
And if anyone can't, I think last time there was a couple of people there, it didn't work. So if that's the scenario, I'll email out a Microsoft Forms version after the meeting.
Yeah. Thank you. As that's just coming through for folk. And please do let us know what your thoughts are. These are very high level brief overviews for you, just to get you thinking about what you can take back to your workplace, thinking about your practice, thinking about what you might do differently in the future. And then if we go to the next slide, please. Thanks, Sandra. So there's our fundamentals of innovation training. We run them face to face. They're an all-day event, free at the point of contact. It's your time out of your organisation that is the cost. We run them alternately between the East and the West to make travelling for folk easier. Next slide, please. And then just a huge thank you for joining us. I hope it's been useful, certainly thought-provoking, thinking about the importance of actually being able to measure the impact of your work, measure the impact of the value of your practice. We do have a free drop-in session. That's the 1st of May at 10 a.m. If you would like to drop into that session, it's just half an hour. You've got more questions you'd like to explore something further, then please do. That will be sent to you in the email that Sandra sends round. And if you've got any queries or you'd like to follow up on points with us, please do email us at Dorset Innovation Hub at nhsdorset.nhs.uk. And please do spread the word about our community of practice events. It's great to see so many of you here today. So if you just go to the next slide, please. And that's
Brilliant.
it. So huge thank yous to Sandra, to Michelle, wishing you a fabulous rest of your afternoon. And hopefully you go away thinking, right, this is what I'm going to take back to your practice. Take care, everyone.